Okay, so get your lab supplies. You have LabQuest. If it needs plugged in the box is your charger, so you can plug it in. So you're going to take it, you're going to turn it on with the power button. We have to plug in all our stuff. So the first thing is you have a body temperature probe. So this one, the white end, is going to go into channel 1. Oh, we need to plug it in. So it goes into channel 1. Then you're going to take the other end and you want to stick it on your patient, but you got to tape it down to them. So grab some tape. Take your arm and turn it like this. So you want to take down the actual probe. How much do you like the hair on your arm? And then tape some down here too so it doesn't fall off. So you get the temperature probe on there. Then we have to set up your gas pressure sensor. So this one's going to measure your respiration rate. So you want to take it, you want to open it up, and you're going to stick it on their middle to where these two cords are coming down like this. So, lean forward. I got to get this through. Okay, arrange it so they're in the middle. No? So you're going to take it, you're going to wrap it around, kind of tight. You don't want to cut off circulation. Then you can lean back. Then you have your gas pressure sensor. Make sure it says gas pressure sensor on it. You're going to take the end and on your tube, you're going to take this tube and you're going to connect it. And then the white end goes in number 2 or channel 2. Like that. Then when you're ready to go, you have a bulb. You want to make sure it's closed so it actually fills up with air. And you're going to pump it up. You want to pump it to where it's tight, but you don't want to cut off circulation. So tell me when it's uncomfortable, but you can still breathe.
Right there.
Good. Okay. So that's what's going to measure his respiration rate. Then you're going to get it. The last thing you're going to do is measure pulse, but with pulse you're just going to do their radial pulse. So on their wrist, you're going to feel for their pulse. And so you gotta listen, or you'll have one person that's measuring pulse at the intervals. So if you look at your data table that's on your thing, your body temperature will measure every 30 seconds, and that'll be done by the Logger Pro. Your respiration rate will measure every minute, and that'll be done on the Logger Pro. The pulse we measure on the 1 minute, the 3 minute, the 5 minute. So every 2 minutes. So whenever you measure pulse, so you start out initially, and you'll have to listen for 30 seconds, and then multiply it times 2, and that's how you get your pulse. Then you'll wait till you hit the 3 minute mark. You'll have somebody measure pulse again and record it, and then wait till you get to the 5 minute mark and measure pulse again. And you're going to record it in your data table. So when this goes, you're going to get on your LabQuest and you're going to hit start, and the start's going to start collecting your data. So the start is this top button here. You'll see this turned off, but there's a little green thing. You'll see the picture in the document. It's going to start collecting your data, and you just have to let it sit and collect the data. You don't have to record anything yet. We'll do that after we finish it. So we want to let him sit probably for about a minute and just get his normal vital signs. Then we're going to let him play Perfection, and you'll notice on your link or on your document that you have the time that Perfection started and the time that it ended. So you want to record those. So whoever's watching your clock, if we started at 2 minutes and 3 seconds, write that down so we know. So with the Perfection, since we have the temperature probe on one arm, he only gets to use the other arm for the Perfection. He can't use both. Okay, so you lay out the toys. You ready? So you move it over to 10, hit on.
Hurry up, Drew.
Huh?
Is it hurry up?
Really?
I suck at this.
Nope. Okay. So you want to let them play, and then give them a minute. You want to keep collecting vital signs. That way we can see the change afterwards. Stop playing. And then, so you're going to get all the stuff, and then you can stop your data collection. And when you hit stop, you're again just going to hit this button and it'll stop it. You're going to take your flash drive and follow the directions on your screen. But your flash drive, you're going to insert it in up here. It goes right like that. And then you'll be able to save that data to your flash drive, take it over to your screen on your computer, and we can analyze it on the computer. So that's how you run the perfection part of it. When you get to the experimental design, you guys have to decide what stressor you're going to expose them to. So again, with the stressor, you want a little bit of time that you get your before vital signs, expose to a stressor, and you don't want them to know what the stressor is. So you're in a group 3, so 2 of you plan out the stressor, and the third person, you don't get to know what's going to happen to you. Within reason, okay? Don't go nuts here. So you expose them, then give them some time to recover, because they're going to want to use biofeedback in order to calm down their vital signs, because they don't want to get stressed out. They want to calm themselves down. That's the setup.